South Africa's largest medical insurer, Discovery Health, says the two-shot Pfizer COVID-19 vaccine offers 70% protection against hospitalisation and 33% against infection by this new Omicron variant. Let's talk about this further with the Progressive Health Forum's convener, Dr. Aslam Dasoo. Dr. Dasoo, always great to have you on the program. So, I suppose you can correct me if I've got this wrong. The summary from today's briefing and the research is that currently with the Pfizer vaccine, you've got a higher chance of infection, but less of a chance of being in hospital and dying, correct?
Good afternoon. Yes, that's about the size of it in this wave in particular. It's in keeping with, I think, other data that's been already published. And it's important, however, just to say that, look, this takes up the first 3 weeks of this wave's data. And I'm pleased that that Discovery has actually done this together with the Medical Research Council, which means that the data has been shared and one can have far more confidence in it. And I think it's showing this very well-noticed decoupling of the number of cases from the number of severe illnesses, hospitalizations, and deaths in particular. And it's the first of the variants to demonstrate that pattern. Now, whether this is going to be a harbinger of anything else is still very much open, and I think we must not get ahead of ourselves as far as that is concerned.
And as you say that, then I'm wondering how much consideration the government, as we know tonight, the National Coronavirus Command Council and the Deputy President are meeting to discuss South Africa's journey with the pandemic and what to do next. How much attention do you think they should pay to this very early, as you say, research that looked at only 3 weeks of data by Discovery and the Medical Research Council?
Well, I think the tasks of the Command Council, won't really be affected by this data, because the Command Council has to put the country on a state of readiness and a state of action or lack of action in certain instances in response to the case numbers as they grow and the effect of that on health services. Now, as it stands, there's nothing really to suggest that we need higher lockdowns or greater restrictions. Those are certainly off the table. The current situation is that the virus is very widespread, so certainly travel restrictions won't work. The information, however, that the virus is only causing mild infection may be a little problematic. Not that it's not causing mild infection, but the message going out with it should not create a false sense of security or even an irrational exuberance. We have a fairly low level of vaccination, and it should not add to that hesitancy that is keeping this rate of vaccination low. As a medical fraternity, we prefer to have a stoic reserve when we come to these issues. The data is not yet in. There are some encouraging preliminary signs, but it's only when everything is collated and we reach a point in the wave or in the pandemic where we can confidently predict or state that we are at a point of decline of a wave or at the turning point of the pandemic, and that has not yet occurred. So one must be careful about the messaging at this point. I think what it is showing, this data, is that the vaccines are still as effective as we had expected them to be, even with the Omicron variant. The very high protection against severe disease has been maintained, so that despite Omicron having far more mutations that could allow it to evade existing immunity, both the vaccination as well as natural infection has created sufficient immunity to attenuate that particular fact of serious disease or admission.
On that point then, Dr. Dasoo, we've spoken throughout the various peaks in infections from last year about how we actually only ever really deal and respond to people who present with symptoms. Even with the Delta and Beta variants, you had the asymptomatic people, which some have argued in the science community is possibly a larger number than those who actually turn up at labs and hospitals. Do you think there's an increased chance of that now, given what we're learning about Omicron?
Yes, of course, always. And I think that's simply the accepted distinction between reported cases and what really happens. So I think what the Discovery study does show is that it's taken quite a large sample of its membership, and we can probably extrapolate from that the amount of infection is pretty much mimicking what's happening in society. So as far as that is concerned, I think that's fine to be able to say out loud. But here's the issue. There's a lot of information. There are a number of studies. There's statements coming out from healthcare leaders, very optimistic and so on, that may cause confusion in the minds of people. And I think we need to go back to first principles. We are still very much in the grip of the pandemic. This variant may well turn out to be more benign than the previous ones. But the next variant, and there's most likely going to be another one, may have a different attitude to Omicron and may cause a very different disease pattern. So it's best to hold a healthy skepticism about everything, but to be sure about the following: that vaccination protects you against severe disease or hospitalization and death. And natural infection does provide a degree of protection as well. So the numbers we are seeing of low hospitalization, which is, we believe, a direct consequence of existing immunity, it can be explained in that way. But we have a long road to go. And it's important that people maintain the view that we are in the pandemic and that we take the necessary precautions to protect ourselves, as always. Because even if you get a mild infection and get over it quickly, the phenomenon of long COVID still is a specter that can be very debilitating. And so you should do everything you can to not get infected. And that would mean making sure that you put the correct barriers in place, masking, avoid all the non-essential gatherings, and there'll be many now during this period, avoid unnecessary travel and that sort of thing. And try and keep yourself as far as you possibly can away from the risk of getting infected.
Okay.
This is very important. And the number of infections that we're seeing is not just a function of the fitness of this variant, but also the degree to which people are not adhering to these necessary protective measures.
Final question then, Dr. Dasoo. We were listening to Health Minister Joe Phaahla after getting his booster shot today, and he was saying, look, the health department is going to roll out boosters for the general population, starting with the over 60s first, because currently they're the only people who fit into that 6-month period that government is looking into for the last time you got your shot, which would be the time of the second Pfizer shot. Do you think we should just go ahead with giving boosters to whoever wants them now?
Yes. Now, let me qualify that, though. The 6-month period is actually quite arbitrary. You could give a booster from 3 months onwards. In fact, that's what they do in several other countries, including the US and the UK, I believe. And so giving it after an interval of 3 months from your second dose is perfectly valid. I think what we have here is the government's logistical approach to this, trying to maintain, some semblance of an orderly progression. But, we are now too far into the pandemic to be focused on such a bureaucratic approach. I think that the vaccine MAC and the Coronavirus Command Council need to take a more expansive view, open this up with the low amount of vaccination, low rates of vaccination we have, and an increasing demand from many people who've taken their 2 shots of Pfizer to get the booster, but who won't qualify according to the government's criteria. Those factors are important to take into account. We have sufficient stock, certainly, to do this. And we think that opening it up much more widely, taking away the restrictions on an age-related descending
the age
approach.
categorization, yes.
Yes. I think it's probably far too rigid, and the growing body of scientific opinion is very much against it. And I think we can do it. I see no reason why we even have to wait until January, for this. But January is just around the corner, and that's okay. But I think the idea that you can only get your booster after 6 months puts a number of people at risk. We know Omicron is capable of evading the Pfizer protection for mild disease quite significantly. And so we don't want more people to get infected. So open it up is what I would say.
Dr. Aslam Dasoo, always a pleasure to speak to you. Progressive Health Forum Convener, Dr. Dasoo, there speaking to us as always. Thank you, sir.